if you want to get selected in the PG entrance examination, two bases must be covered. The grip on the conceptual topics has to be strong. The grip on the conceptual topics has to be strong. Why? You cannot, remember all the facts. Again, it's difficult. Why? The same thing, your brain has limited capabilities. So you cannot just memorize everything. The conceptual topics must be understood properly so that by logic you are able to answer those things. Probably conceptual topics would cover like 60-65% of your course or 70% of your course. At the same time, you have to ratify your way through the factual topics. There are certain things that have to be remembered. There is no other way, right? If I tell you that clozapine is an important drug, and I tell you there are 3 important side effects. One is agranulocytosis, second is myocarditis, and third is the seizures. This is a fact. You have to remember it. But then I tell you that because clozapine can cause agranulocytosis, that is why when the patient is on clozapine, you have to do blood monitoring once a week initially, then once in 2 weeks. This blood monitoring part is again a conceptual part. You have to remember the fact, but the second part becomes a concept. If you know this fact, this concept is easy to remember. You don't really have to remember the other thing also. So a combination of concepts and facts is what it's going to take you through it's going to get you a good rank. So we have to give importance to both these things. There is no other way. If you think that only concepts can help you pass examination, not going to happen. If you think only facts can help you get pass the examination, again, not going to happen. There has to be a balance. There has to be a combined approach. PYQs, PYTs. Again, every single teacher that is, a faculty in PG entrance examination would tell you the importance of these previous year questions and previous year topics. The problem is, the mistake that many of us do is we keep on postponing them. We keep on thinking कि PYQs तो करने ही है. We have to do PYQs. Let's finish other things and in the end we will do PYQs. And in the end the time is not left. My dear students, availability of content is not the rate limiting step. It's not the limiting step. Probably 10 years back, we did not have any content to study from. We had certain books and that is what all we had. Today, there's a excess of good content. Great content is everywhere, right? But something that has not changed is the time that is available to you. So you have to structure your skill or your preparation in such a way that all these important things are being taken care of as you move forward. So PYQs would always be important. PYTs, we are seeing increasingly that the question comes from the same topic, but you cannot just memorize the question because they will ask something different. They'll make some changes. So the question would again be from the same topic, but it's not the exact same question. So if you're just trying to memorize the PYQ, it might not help you. 10 years back, it used to help. There used to be a book called AAA, Amit, Ashish, Arvind, something. It would have 10-year questions, and some of us would just ratify it, and the same question would come in the examination. It doesn't really work that well anymore. Of course, certain questions come from the same thing, but it doesn't work that well anymore. So you have to be good in PYQs, PYTs. You have to ensure that you're practicing MCQs. When you study, when you read, you get the information. When you practice the MCQs, you get to know about the nitty-gritties of solving the questions, right? Many people talk about the smart approach of answering a question, how to rule out certain options, how to make a good guess. See, how well are you able to make a good guess, or how good your guess is depends upon your fund of knowledge. If you are somebody very knowledgeable, the chances that your guess would be good are very high. At the same time, there are certain things that you learn while doing the MCQs. So we have to do lots and lots of MCQs so that our MCQ taking abilities in itself also improves. And getting accustomed to 3.5 hours exam. If you have not taken a 3.5 hour exam in the entire year, and on the day of exam you are doing it for the first time, you might have some problem. You might have some issue. First is anxiety, right? When you take grand test, you are kind of putting yourself in the same situation. So we have to desensitize ourselves, right? We talk about how to treat phobias. You have to do behavioral therapy. You have to do exposure therapy. The more you expose yourself to the field stimuli, the lesser anxiogenic it becomes. Similarly, you are afraid of exams. The more you expose yourself to exams, the lesser anxious you will become. And it's not a small point. My guess is, I don't have a data on this, my guess is if you are very anxious on the day of exam, probably you will end up making 5 to 10% more mistakes, the so-called silly mistakes. When you're too anxious, you're not able to think logically. You are totally dependent on the memory. So the logical part starts getting hit. If you're calmer, you don't make those mistakes. So ensuring that you are good during those 3.5 hours is also pretty important. I don't have to tell you that how much difference can these 5 to 10% marks make. You know that it make a difference of thousands of rank. मैं अभी आप लोगों के क्वेश्चंस देखूंगा बेटा, but let me complete this. All right. So enough of theory. How are we going to achieve it? All right. This is a cliche, but there is no substitute to hard work. There is no substitute to hard work. And hard work is, as a psychiatrist, I should not use this word, but let me write it here. It can be addictive. It can be addictive. Just to make a point, right? Hard work can be addictive. Why? See, again, it's very simple. I often ask this question. You say you have 2 days. The first day, you spend 2 hours watching a movie on Netflix. Then you spend 2 hours watching Instagram reels and seeing all those reels, so beautiful, so elegant, looking like a wow, hundreds of times. And then Badal Bijuri or whatever is going nowadays. And then you spend 2 hours watching YouTube shorts, and then you call your friend and again talk for 1 hour. And after doing all this, you study for half an hour and then you go to bed. Do you really feel good? Do you really feel happy? Do you really feel satisfied? Do you even get this feeling that I had fun today? Neither are you feeling happy, neither are you feeling satisfied, nor are you getting any kind of fun. Then how is it a good day? Compare it with another day. You studied for 11 hours in the entire day. You are dead exhausted. You are tired. Your brain is just not working. You're having headache. But you go to bed. You switch off the light. What is the feeling? The feeling is that of satisfaction. In your heart, you know that you did what you were supposed to do. And don't you crave for that feeling? Isn't that what we all crave for? Feeling that I am doing what I am supposed to do. So if you compare both these days, in one day, at least you studied for 11 hours and going to bed with a feeling of satisfaction. In the other day, you are not doing anything and still suffering. Then how could it be a good day? You cannot fool yourself. You can fool everybody else in the world. You cannot fool yourself. In your mind and heart, you know what is it that needs to be done. Unless you do it, you would not feel peaceful. The peace will evade you. The peace will be away from you unless you do what you are supposed to do. It may be, it may be pressure. This sentence may increase pressure on you, but this is how it is. We are trying to crack a tough entrance examination. Here we are dealing with the cream of the country. People who get into medical colleges, they are cream. And now you are trying to best them. Of course, it's going to be a pressure situation. But we have chosen it. We are looking for some kind of glory here. And people can make judgments that whether getting into this cycle may be right or wrong, but that is what we have chosen. And if we have chosen this game, we'll have to play according to the rules of this game. And the rule of this game is single. It's a singular rule. And what is that? You have to sacrifice and you have to struggle. Nothing great can come in life without struggling, without having to struggle and making sacrifices. All right, hardcore equation, basic equation. 110 or 11 days are left. The equation remains very simple. You have to study for 10 to 12 hours a day. 9 out of 10 days. You can take a break once every 10th day. And later on, it will become probably 14 out of 15 days. Maybe in Feb. It will become 14 out of 15 days. All right. We have to take the preparation till the end. I have already said that. We will follow a structured schedule. A structured schedule that will ensure that we are taking care of both the concepts part, we are taking care of the factual part, and we are moving in a right way, not spending too much time on any particular subject, not ignoring any subject, taking care of the concepts part, taking care of the PYQs part. All of that has to be taken care of. And we have to show up daily. Every day we have to have some kind of answerability. We have to have some kind of mechanism which ensures that we do it every day. All right, let's talk about the cerebellum strategy that we have decided. So till now we were having some kind of conflicts in the schedule. we were running our mission NEET-PG lectures, which were taken by the subject specialist. Dr. Zainab ma'am was taking BTR sessions. On days there were some kind of conflicts also, the two classes running on the same time, and students were getting troubled what exactly to follow. So after a lot of efforts by Zainab ma'am also and by me also, we finally created a schedule where there are no clashes. Things can go smoothly and we can cover everything that needs to be covered. So here is the strategy. First part is, let's talk about students who have already completed the course. Now, if you are a Cerebellum student and if you have done mission NEET-PG lectures, the live lectures that we were conducting, which just ended like a couple of days back, my advice is revise the same lectures. If you have made notes, even better, revise the same lectures. If you have been following the main videos, recorded videos, it could be from Cerebellum or from any other platform, revise from the same source. If you use some other platform for a particular subject, and if you have a good hold on that subject, the best thing to do, the logical thing to do is to revise from there only. See, the more you revise a particular thing, the better it goes in your head. If you have followed rapid revision or quick revision, again, revise from there. You can also do a mix and match. Say you have done some subjects from some platform, some from other platform. Again, for the first step, you just focus on the same thing. It will be easier. It will take lesser time. In case you have not done it, say there are 5 subjects that you have not covered, or say there are 15 subjects that you have not covered, or say there are 19 subjects you have not covered anything and you are starting today. Again, we still have enough time to complete everything. 110 days, 112 days are more than enough to complete everything. In that case, my advice would be use the rapid revision videos or the quick revision videos of Cerebellum and the BTR videos. So again, I was discussing with Zainab ma'am. So what Dr. Zainab has done in BTR is, she has 2 parts. One are the main videos and then there is something called as BTR bonus. So I went to the content. I feel the main videos of BTR, the recorded ones, initially they were recorded. BTR bonus I think came out late. It was the live lectures which are now kept in the app. The main videos take care of probably most of the important topics that were asked in the exams. So my hypothesis is simple. The quick revision videos of Cerebellum will help you take care of that conceptual part so that you are not missing on concepts. BTR main videos will take care of all the factual part and also some amount of integration that Dr. Zainab does it beautifully, right? So we have got both the important bases covered. So this is the first part. You either revise, and if you have not done it, you use the BTR plus quick revision videos to cover a subject. First step done. Then we will have live classes. I'll show you the schedule. We will have live classes. In these live classes, what we will do, we will cover all the previous year topics in a proper structured manner, so that you not only have a quick revision, but wherever you are struggling conceptually or telling techniques to remember, all those things that are done in the class, all of that is done. Once you have completed a subject, attended the live lecture, then we will go to the subject wise test and discussion. Say we are starting with pharmacology. You revise the pharmacology. I'm presuming you did it from GRG sir only. You revise whatever sir taught. Then you did his live class on 2 days. Then we will have a pharma test and discussion, what we call as END, exam and discussion in Cerebellum. When you do END, now you are getting the knowledge of the previous year topics is getting consolidated, and you are having that very important practice of MCQs. These would be live lectures, live discussion would be there. After every couple of subjects, Dr. Zainab ma'am would be taking tests of a couple of subjects put together. I'll show you the schedule. Say medicine, pharma, physio, patho. These 4 subjects are covered. The TND has been done for all of them. Then we have a mega TND. I'm just introducing that word, mega TND, in which questions would be asked from these 4 subjects, and a live discussion will be done by Zainab ma'am, BTR. Then we do grand test, of course, the whole idea of ensuring that you get that feel of 3.5 hour session. And the previous year question you have to do side by side. 5-year questions are extremely important of NEET-PG. Now the question that comes again and again is, should I do INICT question or not? It totally depends. If you are somebody who is now revising, you should. If you are somebody who is just starting, maybe focusing more on NEET-PG will help you, right? So all of this is customizable. And please don't get into FOMO. Don't think if I leave INICT I would not get selected. My dear students, it's the time which is the limiting factor. Nobody can do everything. इस बात को, ये बात आपको एग्जाम के दिन याद आती है, एग्जाम के दिन समझ आती है. टीचर्स फर्स्ट डे से चिल्लाते हैं, बट स्टूडेंट को लास्ट में याद आता है. Students realize this thing in the end. Please remember, time is the limiting factor here. We have to structure the program in such a way that we reach the examination hall covering most of the things that can be covered. एक रूल है पीजी एंट्रेंस की तैयारी का, 19 सब्जेक्ट 5 साल में भी खत्म नहीं होते, 1 साल में या 6 महीने में क्या खत्म होंगे? You cannot cover 19 subjects in a year or 6 months, right? So we have to do what is the best that can be done. चलिए. All right, now I will show you the exact dates and how are we going to do it. So yeah, this is the final plan. So I am calling it Mission NEET-PG last lap. ठीक है, last lap है. We are going to start with, of course, the legendary GRG sir. So pharma. So I have given pharma coverage. We have to cover pharma in 14th, 15th, 16th, 17th. In 4 days we'll cover pharma. These 4 days are to be used to revise from whatever source you studied or cover using quick revision videos plus BTR. Then on 14th and 15th at 5:30 p.m. in the evening, we will have these live classes every day. So from 5:30 to 10 or 9:30 or 10:30, we will do the live classes. On 16th, we will do the subject-wise test. We'll give you questions, there will be live discussion. This is how we are going to start. On 17th, Dr. Zainab is going to cover the integrated graphs. So all the graphs from all the subjects would be covered in this integrated graphs. Then we start with pathology. 18th, 19th, 20th, 21st, you have got for pathology. In those 4 days, for 2 days, Spurs sir will come and take the live lectures. 20th, you will have a TND, and then on 21st, Zainab ma'am will take the BTR of histopathology images, right? So everything is going to get coordinated now. While making this thing, I just thought about a phrase that when you follow the schedule, you will have morning to yourself. Your morning are yours, but your evening are ours. The evenings would belong to Cerebellum, because you have to be on the Cerebellum app in the evening session. In the morning session, you have to do their own thing, the revisions and all. So every evening, 5:30 p.m., it's Cerebellum time. Medicine, then we have got physio, then medicine, the big subject. From 27th to 2nd December, we'll try to cover as much medicine as possible. Dilip sir, the exceptionally good faculty, will take 3-day classes, but I understand that it might not be possible to cover the medicine in these 4-5 days. So what I've done is, I have at intervals kept these cover up days. When I say cover up, basically what I mean, whatever gets left, you can cover it up in these buffer days. So cover up days. So again, medicine, self-study, live classes, END, and then Zainab ma'am will take the integrated system BTR. So basically what she's going to do is, pharma, path, physio, medicine, she teaches it as integrated systems. So there would be a test followed by discussion. Then we go from medicine to surgical subjects. We have got surgery, and then there is integrated buzzwords in the BTR, ortho, and then radio. And then we have got some cover up days, and then we have got infections, right? So surgery followed by PSM, dermat, anesthesia. Similarly, we'll keep on going forward. And finally, we come to the last round where you study psychiatry, the most important subject out of all the 19 subjects. Everybody knows that, right? Ophtha, ENT, and we finish it, all of this on 2nd of Feb. We finish everything on 2nd of Feb, right? But the game is yet not over. We did this something called as marathon INICT this time, where in 7 or 8 days we covered the entire course, and our students were very happy. It was very exhaustive, very tiring, but it was another feeling. But the mistake that we made was we conducted this marathon INICT till the date of the exam, like 1 day before the examination we ended. This time we are not going to make that mistake. We are going to give you at least 7 or 10 days before the exam to relax and to study. So on 2nd of Feb, we finished the last lab subjects or last lab classes. From 11th, from 2nd to, sorry, from 1st to 10th, again you have got some cover up days to cover whatever was left. And then we start the final thing from 11th of Feb till 24th of Feb. So we'll have the marathon NEET-PG this time, one class after another, and along with it integrated the final mega sessions of BTR. So students, we keep on saying that study till the last day, take the preparation to the last day. This time you are not going to be alone. The faculties, all of us, are going to ensure that we stay with you till the last day, because we know that that is a game changer. When you have somebody to listen to every day, when there is a schedule, when there is somebody out there who is ensuring that you are being taught, you yourself becomes accountable. You become accountable. So this is our plan for you till the last day, till the 2nd of March. If you are a student of Cerebellum Academy, you don't have to do anything. Just follow the schedule. We have been saying that if you're a premium pack subscriber, we would never charge you again. If you are not a part of Cerebellum Academy, you should ask yourself, why not, right? Why are you making that mistake? Sorry, थोड़ा promotion कर लिया बीच में. लेकिन if you should, I mean, I'm hoping that we are good enough that you consider being a part of Cerebellum Academy. Go to www.cerebellumacademy.com, go to plans, find the Mission NEET-PG and subscribe it. When you become a part of Mission NEET-PG, everything that happens in Cerebellum app, you get access to. Starting from main videos, to revision videos, to GTs, to BTR, to live lectures, to question bank, whatever we do, everything is a part of Mission NEET-PG. And because all of you love coupon codes, that's why I have come with the coupon code Cerebellum. The charges are rupees 19,999, and when you use this coupon code, it becomes 18,999. Again, I'll be seeing you in the app, and more importantly, I'll be waiting for your message on the day of result. It will be an honor for all of us to interview you. Please study hard, because we really want to interview you on the day of the results. God bless you.